If you're a man over 60 and you've noticed that your erections aren't as reliable as they used to be, I want you to listen very carefully for the next few minutes, because what I'm about to explain is something most doctors never talk about, and most men are never told. This is not a pill, it's not a supplement, and it has nothing to do with testosterone. In fact, it involves a part of your body that almost no one ever associates with erectile function, yet it plays a direct role in whether blood flows into the penis or not. What makes this especially important is that the problem for many older men is not a lack of desire and not even poor circulation. It's a breakdown in the nerve signal between the brain and the pelvis. When that signal weakens, the body simply doesn't respond the way it used to, no matter how strong the urge is. Here's the surprising part. There is a simple, non-invasive way to stimulate that nerve pathway and support a stronger erectile response in under a minute, using something you already have in your bathroom. It sounds strange, I know, and that's exactly why most men dismiss it before they understand the science behind it. But once I explain how the nervous system controls erections and why gentle stimulation in one specific area can amplify that signal, it starts to make complete sense. I'm Dr. Fiona, and in this video, I'm going to walk you through the exact mechanism involved, the common mistake that makes this technique fail for most men, and how to do it correctly so you don't irritate the nerve or waste your time. This is not a guarantee, and it's not a replacement for medical care, but for men dealing with mild, age-related erectile changes, this approach can support the body's natural response instead of fighting against it. Before we begin, I'd like you to rate the information in this video on a scale of 1 to 10 at the end. Your feedback truly matters. It helps shape the future content of this channel. Once we understand what most of you want to learn about, we'll focus exclusively on that topic with research-based, science-backed information. Whether it's achieving stronger erections, improving blood flow by addressing clogged penile arteries, boosting low libido, or optimizing testosterone levels, your input guides everything we create. Let me know your rating and the topic you want covered next in the comments below. Stay with me until the end, because I'll also show you how to combine this technique with one simple breathing adjustment that significantly improves the nervous system's response. And this part is backed by clinical research. If you've ever felt frustrated, confused, or worried about changes in your sexual performance, this video is for you. Let's break down what's really happening inside your body and what you can do about it, starting now. Erections are not just a vascular event, they are a neurovascular response. Your brain, spinal cord, peripheral nerves, blood vessels, and pelvic floor muscles all have to communicate efficiently. If that signal is weak or delayed, blood flow to the penis doesn't increase the way it should. There is a small region in the perineum, the area between the scrotum and the anus, that plays an important role in this process. Beneath the skin in this region runs the pudendal nerve. This nerve is essential for penile sensation, pelvic floor activation, and the reflexes involved in erection. When it is stimulated appropriately, it can enhance the signaling between the brain and the pelvic organs. Research in sexual medicine and neurophysiology has shown that targeted perineal or pudendal nerve stimulation can improve erectile response in certain men, particularly those with mild to moderate erectile dysfunction related to nerve signaling, rather than severe vascular disease. The reason is simple. Stimulation increases neural firing, which supports nitric oxide release and improves local blood flow dynamics. Think of it like restoring a weak signal rather than creating something artificial. You're not forcing an erection, you're helping the body respond the way it was designed to. Now, technique matters. This area is sensitive, and overstimulation or aggressive pressure can do more harm than good. Gentle, rhythmic stimulation is key. Light vibration is often more effective than firm pressure because the pudendal nerve sits relatively close to the surface. This is why a soft-bristle toothbrush can work as a tool, not because it's magical, but because it provides mild, consistent stimulation without excessive force. Cleanliness is essential, and the contact should always be gentle. The goal is nerve activation, not irritation. Duration is another point where many people go wrong. More is not better. In clinical neuromodulation studies, short periods of stimulation are often enough to activate neural pathways. Around 20 to 30 seconds is typically sufficient. Prolonged stimulation can lead to desensitization rather than improvement. Timing also matters. This technique is intended to be used shortly before intimacy, when the body is preparing for arousal. If it's done too early, the neural effect fades. If it's attempted after significant anxiety or performance stress has already set in, the sympathetic nervous system may override the response. As stimulation begins, many men notice a mild tingling sensation in the pelvic region, warmth, or a subtle increase in fullness. These are signs of increased neural and vascular activity. Visual or mental stimulation may amplify the effect, but the neural response can begin even without it. There is one additional factor that significantly enhances results, and this is supported by psychophysiological research: breathing. Slow, controlled breathing activates the parasympathetic nervous system, the branch responsible for relaxation, arousal, and erection. When deep breathing is combined with peripheral nerve stimulation, the body receives two reinforcing signals that it is safe to relax and respond sexually. In clinical studies, controlled breathing patterns have been shown to enhance physiological arousal and reduce performance-related anxiety. This is particularly important for older men, where stress and anticipation often play a larger role than physical limitations. So when these elements are combined, gentle perineal stimulation, brief duration, correct timing, and slow diaphragmatic breathing, you're supporting the natural erection pathway rather than fighting against it. I want to be clear, this will not override severe vascular disease, advanced diabetes-related nerve damage, or hormonal deficiencies. It is not a cure, and it is not a substitute for proper medical evaluation. But for men experiencing mild changes in erectile responsiveness, especially those driven by nerve signaling and stress, it can be a helpful, supportive technique. The takeaway is this: erections are not just about blood flow. They are about communication between the brain and body. When that communication improves, function often improves with it. If you decide to try this, pay attention to how your body responds, not to exaggerated expectations. And if erectile changes are persistent or worsening, speak with a qualified healthcare professional. Sexual health is health, and it deserves real medical attention. Thank you for listening. Take care of your body, take care of your nervous system, and I'll see you next time.